Am I right in thinking that with an unloader brace, it's targeted at uni-compartmental OA?
Yes. So it's specific for, we can go on to the indications, but it's specific for any unicompartmental condition that would benefit from unloading. So that includes meniscal indications. They're also used in a variety, different varieties of them, from biomechanically very similar, can be used post microfracture treatment, for example, more other cartilage-based issues like Oates procedures, Macy and ACI procedures. And it's basically where you need to consider the load going through that compartment. The main thing really is unicompartmental osteoarthritis, and certainly originally we were thinking more about sort of lower levels, lower Kellgren-Lawrence levels, but they actually found that for all levels of osteoarthritis, they can be useful in affecting change.
And I think statistically, the medial compartment of the knee is most commonly affected. I don't even know if there are ever any problems with the lateral compartment. Can you work both sides?
Yeah, we have lateral versions. Yeah. They account for sort of 20-30% of the ones we sell. So effectively, most of them are medial conditions. Yeah. But you can get lateral versions, and that's not uncommon if someone has a valgus knee position or that sort of thing. So it's a different version, but we have them.